If you're in the military, you're always ready to serve. Right now, that means traveling to COVID-19 hotspots.
As we bring you back live to the Javits Center, it is expected to be a field hospital up and running possibly as early as next week.
I believe April will be tough. I believe May will be tougher. We will get through to better days.
Flatten the curve, slow the spread, so the healthcare system can handle it.
Joint Task Force Civil Support got the call on March 24th to head to New York to support FEMA's response to the COVID-19 outbreak. Their mission is to help alleviate the burden on the New York hospital system by providing medical support at a field hospital at the Javits Center in New York City.
The governor of New York directed that the Javits Convention Center be transformed into a field medical station to assist the city of New York with the expectation that the New York City hospitals will become overwhelmed due to the COVID pandemic. I think it was challenging for every soldier, but I think what really helped everybody through was the importance of what we're doing here.
Department of Defense was going to do non-COVID only, and because of the great work the states have done to decompress hospitals, we went to treating COVID patients, and so that caused us to change our game plan. It's also been incredible to see the Department of Defense response and how quickly we've been able to bring our teammates across from the Army, Navy, Air Force, Marine Corps, Reserve Component, National Guard to help support FEMA and ultimately the states of New York and New Jersey.
The usual mission of Joint Task Force Civil Support is to respond to a nuclear attack on an American city. In this very different disaster, they took over the Javits Center in a matter of weeks.
It's absolutely amazing to see what our servicemen and women are doing, because we've got people from the Army, the Navy, Air Force, and Marine Corps all running this operation, and I've just been very pleased with what folks are doing. And I would tell you, the city of New York is very appreciative of that and the level of care they're providing.
Signs of progress in the city. The final patients at the Javits Center Field Hospital were finally discharged today, making a triumphant departure to the sound of applause and bagpipes.
I think for all of us involved with that, it was a moment of reflection of, what happened over the previous 31 days.
As I walk away from the Javits Center here, I'm reflecting on the things that we've seen here. The first day we came on the floor, we were met by Army who have been here for months, working with the Navy, other Air Force and Marines, treating patients. We've had some great victories that we felt when we've seen people go home, which is the reason we're here. I'm excited to see what's next as we transition into the hospitals.
Joint Task Force Civil Support is working around the clock in hospitals in New York City. They're supporting doctors and nurses in the fight against COVID-19.
It's very emotional when I am holding a patient's hand and saying, "You're gonna fight with me. We're not giving up on this." I'm calling it a beast. This beast is not gonna win.
So we've settled into Elmhurst Hospital. We've had a chance to meet a lot of the administrators and the regular staff. It's a whole different world between here and the Javits Center. When we stepped foot in the Javits Center, we were able to see people on their way out the door doing better, really on the mend. Here at Elmhurst Hospital, there's a steady influx of people that are still sick. They just had no idea that it was going to be what it is. This fight's still ongoing for them.
Every day at 1900, everyone in the community, they come out and they start clapping very, very loud, cheering for us.
Every place that I've been, I hear the same words. We knew we were going to be all right when the cavalry arrived.
Our
local service members who have spent the last couple of months in New York helping to fight coronavirus will be heading home soon. They spent weeks treating COVID patients at a convention center turned makeshift hospital. They treated more than 1,000 patients.
They're still providing care in 9 New York City hospitals and 3 New Jersey hospitals. But as the curve begins to flatten, the task force's commanding general sees light at the end of the tunnel and says the group could be sent home within weeks.
Are they ready to go home? Well, sure, they're ready to go home. But we're closing out the mission in a responsible way. You know, we don't want to keep them here a second longer than they're needed because they've got civilian jobs that they have to go back to, and their civilian employers, I'm sure, want them back.
And they might be needed again. Major General Bill Hall says if there is a COVID-19 resurgence in the late summer or early fall, the team is prepared to come back, either to New York or wherever the country needs them.